All right, so let's wrap up this chapter with the muscles of the hip and lower limb. Again, commonly lower limb, we commonly think of that as the leg. The bones and muscles of the lower limb differ structurally and functionally from those of the arm and shoulder. The pelvis, unlike the scapula, is firmly affixed to the axial skeleton and at the sacrum. Partially needed to help support weight. Again, that follows that structure and function core principle. Things are made the way they are so they can do the jobs, and they can do their jobs because of the way they're made. It frees up muscles that would otherwise be required to fix and stabilize the pelvis, as many of those muscles in the shoulder and the scapula do. Therefore, nearly all the muscles in the pelvis and thigh move the thigh and the leg. The muscles that move the thigh and knee arranged by origin and actions. The anterior muscles that flex the hip, the iliopsoas and the sartorius. The quadriceps femoris group extends the leg at the knee. You have the rectus femoris, the vastus lateralis, the vastus medialis, and the vastus intermedius. These are the ones that are collectively known as the quads. The medial thigh muscle, which adducts the thigh, the adductor magnus, the adductor longus, the adductor brevis. Again, think about these muscles and their actions and their positioning and everything. Adductor is going to move the leg, move the thigh toward the body, and it's going to be a big muscle. The adductor longus is going to be a long muscle that does the same thing, and the brevis is going to be a short muscle. The pectineus muscle and the gracilis muscle are found in the medial portion of the thigh. They adduct the thigh, assist the hip and knee flexion. So here is the anterior superior iliac spine, which is where many of these muscles are going to attach. Here's the iliopsoas right there, psoas major, the iliopsoas. There's the sartorius muscle coming from here, coming all the way down and attaching down here. This is the longest muscle in the body. Vastus lateralis, vastus medialis, rectus femoris, those are the quadricep muscles. Those are superficial muscles. Here are the adductor muscles. These are the deeper muscles. There's the adductor longus. There's the adductor magnus and the adductor brevis. I'm not seeing it there. It is right there. Quadriceps muscles, the vastus lateralis, vastus medialis, vastus intermedius, and the rectus femoris, which has been sort of cut away. And there's the cadaver view of those muscles. Again, so here's the view with all the muscles listed and the chart. Back up one. So again, all of these muscles are on the front component of the leg. So the quadriceps muscles and all of those. The gluteal group on the posterior pelvis extends, abducts, and rotates the thigh. The gluteus medius, medius, and minimus. If you'll recall the other day in lecture, I was talking about these muscles, and I completely admitted that I could never remember whether human beings had all three or the cat we used to dissect had all three. So clearly, human beings have all three. It's the cat that only had the gluteus maximus and gluteus minimus. The hamstring group, those are the muscles that run up the back of the leg, back of the thigh. They flex the knee, the biceps femoris, the semitendinosus and semimembranosus. And then you have the deep posterior muscles that laterally rotate the thigh, the piriformis, the obturator internus, the gemelli, the quadriceps femoris, and the obturator externus. So there's the gluteus medius, there's the gluteus maximus. You don't see the gluteus minimus because it's underneath. There's the adductor magnus right there, the gracilis muscle, and then the biceps femoris, long head, short head, and the semimembranosus, semitendinosus. Those are the hamstring groups. The deep muscles, there's the obturator externus, there's the quadriceps femoris, the gluteus Minimus can now be seen because the gluteus medius has been cut and reflected away. There's the gluteus maximus. So there are all of the deep muscles that control hip movement. And again, showing the movement of the hip forward and back, adduction. Again, watch these videos available on the slideshow presentation in Blackboard. Hang on just a second and let me see what that says. Remembering the difference between the membranosus and the semitendinosus. Semitendinosus and membranosus sound too familiar. Recall the tendons are attached centrally, especially in broad symmetrical muscles. Thus, the semitendinosus is located in the center of the posterior thigh between the biceps femoris and the semimembranosus. As for the semimembranosus, remember that it is the most medial in the hamstring. The calcaneal or Achilles tendon, that is the tendon. Let's see if one of these pictures shows it. Nope, doesn't show it yet. It's the Achilles tendon may be inflamed, tear, or even rupture. It's common in sports requiring running and directional changes such as football. Also, those subjecting the tendon to undue stress, like stepping in a hole or excessive chair climbing. The tendon is vulnerable because the foot is a second-class lever with the fulcrum far to one side. Great deal of force is exerted on the tendon to produce small movements at the ball of the foot. Treatment may be put in a walking boot or surgery to reattach the torn tissue. Prevention, make sure you stretch that tendon well, the calf muscle, before exercising. Vary activity so stress is not always the same, and increase exercise intensity gradually. Muscles that move the foot and toes, the tibialis anterior and extensor digitorum longus on the anterior portion of the leg, the dorsiflex the foot at the ankle, the flexor hallucis longus assists in dorsiflexion of the foot. Its main action is the great toe extension, the triceps surae muscle group, plantar flexus at the ankle, the soleus, the gastrocnemius, and the plantaris muscles. Again, muscles that move the lateral leg, which allow the foot to evert, the fibularis longus and the fibularis brevis. Those muscles deep to the triceps surae group, tibialis posterior, the tibialis anterior, allow for foot inversion. The flexor hallucis longus flexes the great toe, and the flexor digitorum longus flexes toes 2 through 5. Muscles found within the foot, the flexor digitorum brevis, the lumbricals, the plantar interossei, and the dorsal interossei. All of those move the toes. There is the fibularis longus, the tibialis anterior, that's the muscle at the front of the lower leg, the extensor digitorum longus, the tibia, where many of these muscles are going to attach, gastrocnemius muscle, we commonly refer to as the calf of the leg. This is your calf muscle. Soleus muscle lies just underneath the calf, and the reason it is called the soleus muscle is because it looks like a sole, a type of fish. When you cut it, reflect it, and lay it down, it's in the general shape of that fish. Again, there's the tibialis anterior, the fibularis longus, the fibularis brevis, the extensor hallucis longus, and the extensor digitorum longus. On the back of the leg, here's the gastrocnemius muscle, again commonly referred to as the calf muscle. There's the soleus muscle underneath it, but then we've cut and reflected the gastrocnemius so you can see the soleus more readily. There's that calcaneal tendon on the back of the gastrocnemius muscle. Gastrocnemius muscle comes down, and there's the Achilles tendon, also known as the calcaneal tendon. attaches to the calcaneus bone. There is the a grouping again, showing all the bones of the lower leg with its associated attachments. There's the muscle of the foot, showing the dorsum of the foot. This is looking down on the top. This is on the bottom of your foot. There's the extensor hallucis brevis, moves the big toe. Extensor digitorum brevis moves the individual toes. Tendon flexus of the hallucis longus. And then there are the other lumbrical muscles, the flexor digitorum brevis, the abductor digiti minimus or minimi, and other. So this is the tendon that will ultimately form what is referred to as the arches. So this is the top of the foot, and this is the sole of the foot. Some more muscles of the foot, again showing the plantar aspect of the foot. There is the adductor hallucis muscle, the oblique and transverse heads, showing the oblique and transverse heads. The flexor hallucis longus tendon, notice again, longus, it's long, flexes the big toe. Some of the very deep muscles in the foot that are holding the foot itself together. Dorsal aspect looking down on the top, plantar aspect looking up from the bottom. And there is the chart of muscles of the toes that move the toes. Again, most of those muscles that move the toes are actually the muscles that we find in the lower part of the leg. A couple of videos, again, you can watch them on your at your leisure using the links in the PowerPoint presentation in the folder, the course content folder, the course curriculum folder, excuse me. Climbing stairs, muscles involved. You're going up the stairs. Here's the pectoralis major and minor. Flexes the arms. You can use the handrail. The hamstring group going up. The muscles of the iliopsoas, rectus femoris, and sartorius lift the thigh and the hip. Tibialis anterior, dorsiflex the foot, and then you have the gastrocnemius muscle pushing up. And one exercise that we used to do many years ago was to stand on a 2x4 with just your toes. Let your heel go down to the floor, so your foot is sitting like this, and then elevate up, and then come back down. Excuse me, drop my clicker. And then again, all the muscles involved in climbing steps. So you bring your left foot to the first step, flex your right arm to reach for the handrail. You stand upright on your left leg and extend your right arm and forearm to the handrail, on the handrail. Then you bring your right leg to the next step and extend it. Take the weight off your left leg, hyperextend your right arm to swing it forward, reaching for the handrail again. And that's all the coordinated muscle movements involved in walking up steps. We'll wrap up chapter 9, I believe it is, on muscles. I will start chapter 10, and we'll pick up with it on Friday during lecture. Have a great rest of your day.